So while you're picking out snack for yourself as a diabetic patient or for someone who is diabetic, you will definitely ask yourself, which snacks do I pick? Of course, the goal here is to maintain the glucose levels at a normal range. You want to have full control of your blood glucose levels as a diabetic patient. This is simple nutrition, giving solutions to everyday nutrition problems. Tap on the subscribe button and let's get started. So as a diabetic patient, it's always recommended that we eat 6 times in a day. Those are the 3 main meals with 3 healthy snacks in between those 3 main meals. This is what we call the small frequent meals, and this is why for a diabetic patient you don't want to have sudden sugar spikes, and that is why we encourage small frequent meals so that your body can take up the sugar from these foods slowly, hence avoiding the sudden sugar spikes, hyperglycemia. So the three most important things to consider when you're choosing snacks is the dietary fiber, the protein content, and which fat. Okay, the dietary fiber, the protein content, and which fat. So as a diabetic individual, you want to choose snacks that are high in fiber. You know, the fiber slows down digestion, also slows down how your body takes the glucose from the food that we eat. Number two, you want to choose snacks that are high in protein rather than high in carbohydrates. So less carbohydrate, more protein. And number three, you want to choose snacks with healthy fats rather than saturated fats. Less saturated fats and more of the healthy fats. So which are these snacks? In this video, I'm going to give us 4 good examples of snacks you can take when you're diabetic to have a full control of your blood glucose level. So number one snack is groundnuts. Because groundnuts are very easy to prepare and to carry around. You can have a small tin like this and carry your groundnuts around so that you can have them as a snack between your meals. And why is it important for you to prefer the groundnuts over items like the biscuits, the cookies, the white bread? Is because groundnuts are high in fiber. They contain potassium, calcium, all these good minerals. They also contain protein. They're a very good source of protein, and to add on it, they have healthy fats. Okay, very easy to prepare, and they come with all these good stuff. High in fiber, high in protein, potassium, and healthy fats. This is so much better than the biscuits, the cookies, and the white bread. Okay, and number two snack is eggs. But how do you cook your eggs? So as a diabetic individual, you want to boil your eggs rather than frying them. Okay, the cooking method you choose is important. As a diabetic patient, you not only want to choose which snacks, but you also want to consider which cooking method was used, which preparation method was used, which preservation method was used, so that you get the best of the results. So boiling eggs ensures that you still get the proteins but with less saturated fat, because frying introduces so much fat during cooking, and that is not what we want for a diabetic patient. So boiled eggs is another good snack for a diabetic patient because of the proteins, the satiety, and also the good control of your blood glucose levels. But will you be eating eggs every day? Of course not, because too much of anything is eventually poisonous. The snack number 3 is a cup of porridge. I'm talking about a small cup, about 200 or 250, 200 mils cup. Okay, a cup of porridge will ensure you get the carbohydrates you need, the energy you need to push you to the next meal, satiety, so that you don't snack on things like the chips, the biscuits. And also a cup of porridge gives nourishment. You can enrich your porridge with the groundnuts, the milk, to make it better and more nourishing. Okay, and the fourth snack is basically fruits. Do you remember in the video when you were talking about which fruits you should choose as a diabetic individual and which fruits shouldn't you choose when you are diabetic? So again, we were talking about the glycemic index. I've mentioned the glycemic index quite a number of times. We settle for the fruits with a low GI being the best, and avocado is a very good example. Avocado gives you fiber, it gives you healthy fats, okay, it gives you the vitamins that you need. It's a low GI fruit, which is nice, but I'm not saying the mangoes, the bananas, and the pineapple should not be eaten, but you need to master the skill of portion control. You need to moderate how much of these fruits with a higher GI you're taking, so that you'll be able to still maintain your blood glucose levels at a normal range. So when you're talking about which snacks are good, of course, you want to establish which ones are not. Okay, the sweets and the candies, the sweetened drinks, the energy drinks, the packaged snacks that contain so much added sugar, so much added fat, so much added salts, unnecessary things should be avoided. This is because when you're eating all these fried potatoes, the chips, the sweetened drinks, you're taking saturated fats, you're taking sugars, and of course you're risking yourself to a poor control of your blood glucose levels. So this video just mentions four, but which other snacks are you taking? Yogurt, a cup of milk, maybe? Tell me on the comment section below. Let's talk about it. So thank you so much for joining me today. I hope this video helps a little bit, answers one or two of your questions, and don't forget to subscribe. Until next time, bye.